It's becoming an all too familiar scene. Queues of people lining up outside hospitals in New York City to be tested for coronavirus. As the crisis in the Big Apple is set to reach a critical peak in just a few weeks, its hospitals and healthcare workers are already feeling the strain.
We had roughly 1 in 4 patients require intensive care, and we were not ready for this by any means. We are approaching a point where we're going to be overwhelmed, and we need help yesterday. We need protective equipment. The nurses don't feel safe. A lot of my colleagues have gotten sick. A lot of nurses and doctors and other medical staff have gotten sick. We want to have the level of protective personal equipment, our gear, the face mask and shield. We've seen the CDC relax those standards, and we want them actually raised.
Additional facilities like this convention centre in Manhattan are being set up to help with the overflow. This won't be for people who have the virus, but those that need medical attention for other reasons, like broken bones. It's also being used as a distribution centre for much-needed supplies, like gloves, gowns and masks.
While an additional 1,000 beds will initially be set up here, New York State Governor Andrew Cuomo gave a dire warning that this and other measures, like the additional medical supplies behind me, are nowhere near enough. He wants more help from the federal government, and he wants it now.
Ventilators are the most pressing item. New York will need 30,000. Currently, there are 11,000 of the life-saving devices in the city after the White House sent 4,000 and state authorities purchased the rest. Local officials and healthcare professionals have decried a lack of coordinated federal action.
The supply chain problems are critical, and they are national. This is in our national response framework and plan. We have a very beautiful, fabulous plan at the federal level, and it all fell apart. I think that it still is imperative that we centralize our supplies so that we can triage these supplies to the states and even individual hospitals that need it.
This crisis is predicted to come in 3 waves, with each wave becoming more manageable. A glimmer of hope for now, the New York governor saying social distancing measures appear to be working and helping to slow the number of people admitted to hospital.
I'm not sure, what to expect. We are bracing ourselves. I'm really inspired by the wonderful work of the nurses and doctors and healthcare professionals around me. They're truly, we come in every single day, no matter what, and we are here to do a job. And again, if we have the proper protection and the staff and the resources, we can overcome this. And we will overcome this one way or another.
New York hospitals have been leaving no stone unturned in the fight against the coronavirus, trying new drug therapies like the anti-malaria drug hydroxychloroquine, as well as other experimental procedures. The race to find a cure is on. For those working on the front lines, this race is becoming more like a marathon, and the finish line is not yet in sight. Jade Barker for TRT World in New York.